Welcome to Journey, a MedPro podcast. We are so excited that you're joining us for American Heart Month. My name is Vanessa. I'll be your host, and we are here meeting with Christi. Hello, Christi. Thank you so much for being here today and taking the time to speak with us. Really excited
to be here.
Yay. So, as I mentioned, right, it's February is American Heart Month, and so why don't we share a little bit about why you are our guest for American Heart Month and share your story a little bit.
Absolutely. I'm excited to be able to kind of talk about this month and what it means to me personally. So on a personal note, I have been affected by cardiac disease. I was born with a congenital heart defect that actually wasn't really too restrictive as a youth. I only had to attend a annual appointment, get testing done on an annual basis, and monitor it. But I was a very active child. I was able to compete in sports and dance, and so it really didn't restrict me from doing anything, which was great. Unfortunately, when I became a young adult at 25, they uncovered an aneurysm starting to form on my ascending aorta. And I know sometimes the word aneurysm can be a little scary, especially when an aneurysm ruptures, they can be quite fatal. So when you have something like that diagnosed, they basically monitor it, and they're monitoring the size of the aneurysm because they do want to make sure it doesn't get to a critical point and it becomes emergency surgery situation. So I continued with my annual exams and tests, and unfortunately it did grow in size, and when I was 33 they discovered that it had a significant growth year over year, and so they determined that I needed to have open heart surgery. Mm-hmm. Which is quite jarring to hear at such a young age, that you're going to have to undergo what is pretty serious surgery and can be quite scary for a lot of people, and myself included. It was not something that I really handled very lightly. I had to speak to a lot of people, got a lot of professional advice. Luckily, I work for a company that has access to a lot of medical professionals, so I was able to gain a lot of insight as to what the surgery would be like. I was lucky enough to have the surgery locally here. And actually was able to recover and do cardiac rehab locally as well. Some people aren't so lucky in where they can get treatment. When I had the open heart surgery, obviously the goal was to repair the aneurysm. When they went in there, though, they were also going to try and repair my aortic valve, which is where my congenital heart defect started. But unfortunately, they couldn't even repair it because they uncovered that half of it wasn't even working anymore. Wow. So they actually replaced it. And with that, they replaced it with a tissue valve. So I always like to joke that I have a horse valve living inside me. And with that, there are some risks in having a tissue valve versus a mechanical valve. Mm-hmm. And that is stuff that I had to review with my doctor ahead of time. But I did make the choice to have the tissue valve to avoid being on blood thinners the rest of my life, which is definitely a side effect of mechanical valve. Mm-hmm. But the downside of doing a tissue valve is that it's not permanent. Okay. And so, you go into that knowing that you're going to eventually have to have that replaced as well.
Yeah.
And which is, never something that you're excited about. But it is definitely a pro and con situation, and weighing your options as far as what's better for your lifestyle and your quality of life, really. Mm-hmm. And again, had a lot of medical advice on that and was able to utilize resources from the American Heart Association in making that decision, as well as what my rehab and my recovery looked like, both if I had a mechanical valve versus if I had the tissue valve. So in the long run, went with the tissue valve, which I think was the best choice for me at the time. Yeah. Was able to recover successfully and am going back to annual visits again, getting the test done and ensuring that the valve is, operating well, and no need for replacement yet. So
yeah. I mean, it's huge, your journey, and it's sort of that unlucky luck almost, right? Mm-hmm. That you had the opportunity to have this early detection, right?
Absolutely.
So if I think about your story, the things that stand out to me a lot is, okay, the early detection piece, mm-hmm. having the support system and having the education around it, which is so big because there's a lot of information out there, and mm-hmm. a lot of times what happens when there's so much information, you don't even know where to start unless you're hit with it. And at that point, you're also adding the stress of dealing with some sort of medical diagnosis or situation. And so I do want to take some time just kind of talking about when we spoke briefly too, right, there are a lot of misconceptions, if you will, around cardiovascular disease, especially with women and young women. And so I do want to elaborate a little bit on that and how that mattered in your experience.
Absolutely.
And your choices.
Absolutely. And I think, in telling my story, one thing that I really try to emphasize is the fact that I was asymptomatic. So had I not been in the regular care of a physician, specifically a cardiologist, getting these annual checkups, having these annual tests done, I would have gone undiagnosed because there would have been no symptom for me to be concerned about or have, questions about or cause me any discomfort that I would have been seeking medical treatment for any reason. And I think that knowing that I was asymptomatic and having something that could have been fatal in my life really forced me into this advocacy for awareness and making sure people realize this is a universal disease. It doesn't just affect men. It doesn't just affect a certain age group or certain race or socioeconomic class. This is universal. And so for me, I think a lot of times the misconceptions, as you talk about, when we think about stereotypes of cardiac arrest or heart attacks, we think of older population, specifically the male gender, and unfortunately, that's not always the case. And a lot of times for women who have some sort of cardiovascular disease, it does go undiagnosed because there aren't symptoms, or the symptoms are not the traditional symptoms that kind of get played out in the media or on TV or in movies where you think of certain things. And as women, these are things that we really have to pay attention to and can't just brush off as, indigestion or heartburn or just mild discomfort because we're kind of taught to be strong and go with the flow, and we're always taking care of other people that we're very, we're not always taking care of ourselves the best that we can. So I think it's really important, especially for the American Heart Association, to get the message out about early detection or about just recognizing your own, symptoms that might be different than what you thought, or those, different misconceptions.
Yeah. I mean, I think just regardless of who you are, we are always going, right? In our society, it's go time all the time. So even noticing what's happening with yourself, with your body, if something's off, sometimes we don't realize it because we haven't paid attention to what is my normal, right? We haven't been able to really identify that. Or I know so many people that do this, like, I just feel stressed out.
Right.
I'm just tired because I'm really stressed out. And so a lot of it goes back to I'm just stressed, which, that in and of itself is something that I encourage anyone and everyone to kind of work through and talk to someone and figure out how to, lower your stress, because it does have a huge impact on your heart health, right? But to your point, it's hard to get back to, is this normal for me? And if it isn't, what do I do? Do I ignore it? Do I just keep pushing? Or, hey, maybe it's time to just get a checkup, get that baseline, and maybe it's nothing, right? Maybe it is indigestion.
Right.
But better to know it's indigestion than to potentially be having a symptom of something and not realizing it.
Absolutely. And I think, being your own advocate, especially with physicians, most people see a primary physician, which that's great. And if you don't, I highly suggest that you do. But having the annual physical can cover a lot of, uncover a lot of issues that you don't necessarily have to go to a cardiologist to find. But if you're getting, annual blood work, that's going to be able to check your cholesterol and any issues related to that. If you're, requesting an EKG during your standard annual physical, this can also detect some of those things too. So, being your own advocate and asking for those things to be done at that exam is super helpful. So you don't have to necessarily make a cardiology appointment. But if you have, cardiac disease history, family history, if there's anything remotely of concern in your annual physical, you should really make that cardiology appointment and get those things checked out, because even if it's just a baseline, even if nothing is wrong, they can set that baseline as to what your normal looks like, because everybody's is a little bit different. And then if anything changes in that normal, that's when, you can take action sooner rather than later.
Right. Absolutely. I love that. I think it's a huge piece of being an advocate for yourself, because that's challenging, right? Because I mean, speaking for myself, I'm not a doctor, I'm not a nurse, I don't have a medical background.
Right.
So sometimes I feel like I'm not in the place to be an advocate for myself because I don't know, right? Maybe I'm going off my gut or whatever the case may be. But sometimes it is valuable to just kind of push that a little bit and say, I have more questions.
Absolutely.
Because at the end of the day, whether it's your primary or another physician or an ARNP or an RN or whomever, right, that you're working with, their goal is to help you and make sure that you are healthy. And so asking those questions, getting smart, especially in a world where there's so much information to sift through, having someone who knows it and can guide you with that. So really love that as a huge takeaway of just being an advocate for yourself, because you have to be.
Absolutely.
You have to be.
Absolutely.
Yeah. I love that. So in learning a little bit about your story, right, we talked about the American Heart Association, and you mentioned they do have a lot of resources that helped guide you in your preparation for surgery, but also in your recovery for surgery and rehab. And so tell me a little bit more about what resources are available there. What was that like? How did it help you?
Yeah, I think, there's, in my opinion, obviously I'm not a representative of American Heart Association, but just for myself and how I best utilize it and the things that I've noticed since being a part of it and having some awareness to what they do. I look at them as having three kind of arms to their association. The first is research. And I think, in any medical field, in any disease that anybody comes across or medical complication, research is critical to uncovering why, how, what are the options, and then bringing forth medical technology to shorten down recovery times, making surgeries easier, coming up with better ways to even conduct surgery itself. I mean, one of the things about my specific surgery, I had open heart specifically because I had the aneurysm repair. The aortic valve replacement is actually not done as open heart. So if that was the only piece that I was dealing with, that would have been done as a transcatheter replacement. And that is now when I have my next aortic valve replacement, that's how it would most likely be done, unless there's another great, advancement in medical science before then, which could also happen. But that's all through this research. And that's a big part of their arm, is funding research to get better awareness and education out there, and medical technology advancements to grow the overall health of the community. So that's the one branch that I look at as that research arm. The second is more related to healthy eating, healthy lifestyle. Like, what can you do to prevent a cardiac disease to some or a cardiac event in your life. And the three kind of things that they look at with that is diet, exercise, and then overall well-being. And that has a lot to do with stress, as you talked about before, sleeping enough during the night, not having, being able to best manage your stress, being in a good headspace. So if there are things that are consuming you or anxiety that you're dealing with, having a way to deal with that in a way to help your heart as well. So that's another area, and they have a ton of resources as it relates to healthy eating and how to get it moving. And for those people who may not be, a gym person or, a super exercise junkie, but how do you get yourself moving enough to have good cardiac health? And then the last one I think is really special, and they do a lot of support for the caregivers of people who are going through some sort of cardiac disease or who have just experienced a cardiac event. And I think, a lot of organizations might kind of miss out on that piece of it, where they don't realize, any sort of medical treatment or disease diagnosis that an individual is going through, their family is going through as well. And so how can you support the caregiver in what they're dealing with, both from a physical, physically taking care of somebody, as well as emotionally and mentally taking care of somebody, and what resources are available to them to help the person better. And so I do think that that's something that's just, truly admirable about the association, is that they have that special piece dedicated to all the people who are out there helping.
Yeah. Yeah, I kind of want to go back to just like each branch and recap a little bit, right? With research being the first thing. I mean, we see it now. The world is changing so fast. Technology is constantly evolving. And of course, that has a huge impact on what happens in the medical field and how we treat certain diseases or prevent certain diseases. And the work needs to be done in order to make that happen, right? And just thinking about going from open heart to transcatheter is huge, right?
Absolutely.
Because that is a huge risk surgery, right? Even if it's not an aneurysm, right?
Yeah.
And so the research piece is really, really fascinating because it does take a lot of work and a lot of funding and a lot of people to make that happen at the end of the day. And then that second branch, which to me kind of is just lifestyle, right? Again, there's so much information out there on diet that it's hard to sift through everything and figure out what works, right? And if you have any dietary restrictions. So, frankly, I'll be checking out those resources to help guide me through
very good
that.
recipes, especially for Valentine's Day, with all the sweets and everything like that. Yes, they just published a lot of Valentine's Day heart healthy Valentine's Day recipes.
Yeah, you heard it here first. Go check it out. But yeah, it's a big deal, and exercise especially, because it's hard when you're stressed out and you're in go mode to take the time to be like, I'm going to exercise to take care of myself. That's not one of those things that automatically is that taking care of yourself feeling for you, right? For some people too, like you said, that's what gets them calm and into a great mental state. For some people, it's just,
It's more stressful.
I need to push myself to get this going. And then over time, it does become something that releases stress. But getting into the habit and building a new habit takes a lot of discipline, a lot of work, and a lot of repetition. And that overall well-being really sticks out to me because it's probably the least tangible thing, right? You can look at, okay, I need to eat better and have a tangible list of items that you should be eating or should not be eating. And if you think about exercise, right, I can make a list of what exercises I can do, what exercise equipment, how long. It's very tangible. But think about your overall well-being, right? Whether it's anxiety or stress or not sleeping enough. Some of those things are much more difficult to conceptualize and then do something about it, right? And so knowing that and acknowledging that and then taking the first step. So knowing that there's a company out there and there's a ton more, but that has the resources where you can kind of get started is very helpful. And then to your last branch, right? The caregivers, the family members. It's such a big deal and it is often very much overlooked, but taking care of someone, I know I've been in that situation. I'm sure you've potentially been in that situation, or someone who has been in the caregiver situation. It's very difficult because as the caregiver, you want to be supportive. You want to help the other person stay strong, but that does take a lot of energy. And at the same time, you're worrying, right? You are worried for the other person and you're trying not to necessarily show that because you're trying to be strong. So you're in this cycle of, I'm not processing where I'm at because I want to be strong for this person, but I'm feeling a little overwhelmed, but I would need to be there for them. And they're really going through it. And that's a really tough place to be. And when it's solely focused on the patient, that person, that's the base.
They get overlooked.
They sometimes get overlooked and they need those resources just as much. So I love that that's something that stood out to you, right? That they have. So thank you for sharing.
Yeah, I thought it was, really interesting. And I think, kind of going back to the research piece just a little bit too, obviously we touched on slightly, funding. Funding is obviously a big part of any nonprofit association like this because the research is so expensive and time consuming. And you're talking about years of medical research in order to make any sort of, impact in that field. And so I think, a lot of times when people hear about nonprofits, they hear a lot about the funding and they're raising money, and all of that is super important and it's definitely needed. But I definitely want to shine the light on how much awareness that they're spreading as well, and how much resources that they're providing outside of just the research, the funding of research, because I do think it's, not every organization is like that. And I think, so much of cardiac disease can be preventative. There's, unfortunately, I had a congenital heart defect. That's from birth. There was no issue. There was no hereditary issue behind that. And it was just, force of nature that happened. But a majority of other cardiac diseases or cardiac events are preventable. And so the more the population knows how to prevent them, through diet, through exercise, through overall well-being, and getting that message out there is super important to me personally, because I think so much can be done with that.
Yeah, absolutely. I mean, it's kind of this almost this catch-22. I know you and I spoke about it briefly outside, right? It's the fear of the unknown, but then also the fear if it's known, if it's bad, right? And if you think about something as important as your heart, you were like fingers crossed and everything's working as it should, and we'll continue to do that, and I'm doing the right things, because sometimes it's well, I shouldn't say sometimes, but it is scary to face that, whether it's good or bad. When we don't know, we don't know. And some people, and I'm, especially like speaking about myself, I'm definitely a worst case scenario type person, right? So it's really hard for me to take that first step and say, I need to just find out. Right. And potentially it's nothing, and potentially it's something. And if it's something, then I can take a next step. Right. But that is a big step for someone who isn't comfortable, or maybe doesn't necessarily know where to start. And it's scary, right? To your point, it is very scary, but getting that awareness out there, and the more aware we get as a community, the more we can support each other in that too, which I think is super important.
Absolutely. And even, being diagnosed with cardiac disease, some sort of, cardiac disease, doesn't mean it's not a death sentence.
Yeah. And
there are things that we can do, and there's measures that can be taken, and steps and treatments, and all the way from medication to surgery options. So I think, to your point, yes, sometimes it's scarier to know than not to know, but the quicker we find out and the quicker we have that information, the more time that we have to have easier treatment options available to us to, even turn back time a little bit, correct, not just Band-Aid it, but correct the disease itself.
Yeah. Thank you for pointing that out, because it is... Yeah, it's step one to knowing what your options are. And there are so many, right? Because of all this research, because of all these advances, there are so many more options. And I mean, we think cardiac disease, and I feel like a lot of times it goes to heart attack or heart failure or, faulty valves, right? And I mean, I'm not a medical professional, so I think faulty valve, I'm like, oh, that can't be good, right? There's no way that's working. But the reality is, not everything is as high stakes, in the sense that you have time, you have options, and they don't need to be as extreme as surgery. They can be as simple as, hey, you need to get on an exercise bike for at least 10 minutes a day, kind of thing.
I think the biggest thing is high blood pressure. High blood pressure is by far probably again, not a medical professional, in my opinion, what I've seen and experienced, one of the biggest causes to having some sort of cardiac disease or cardiac event in your life. And the sooner you have high blood pressure, a lot of that is hereditary.
Yes.
Some of it can be maintained with diet and exercise. Some of it does require medication. But knowing that sooner rather than later and getting that corrected, you kind of keep yourself out of the bigger situations and the more serious, cardiac events that could come from that. And that's what we talk about: early diagnosis, getting it handled and taken care of sooner rather than later.
Yeah, and I want to go back to what you said about just getting a baseline, right? Because if we don't really know what our normal is, because it is different for every single person, we're all built differently. we won't really know when it's off, right? So
Right.
getting that baseline, and then from there, you can get set up for early detection, early diagnosis if that's the case, and early treatment.
Right.
Yeah.
Right. Much easier treatment options the earlier you go.
Yes, yes.
The earlier it's uncovered. Yes.
Excellent. I love it. So, going back to your story and the American Heart Association, I know I'd like for you to share a little bit about your campaign and what that's all about, what you're doing, and your why, more importantly than anything.
Yeah, so I'm actually very honored this year to be nominated a American Heart Association Woman of Impact, and it's for the Go Red for Women campaign that began on February 2nd, which was National Go Red Wear Red Day, excuse me, and it's a 9-week fundraising campaign to raise dollars for research, as we've been talking about, but also the second arm of that is to raise awareness. And for me, as we've been talking about, this kind of whole segment has been about my passion for awareness and for disseminating the information. And so that was a big reason why I accepted the nomination. Obviously, it comes with a lot of pressure to, raise as much funds as you can. And again, all of that is super important to the cause and helps to fund the research, much needed research that I specifically have been, a recipient of. Yeah. So that I don't want to take away at all the importance of the fundraising and the dollars that are raised during this specific campaign. But for me personally, it was being able to have the platform to get the information out there and make people aware of, again, all the things that we've been talking about early diagnosis, early treatment, what the options are, how much of this is preventable. And to be your own advocate when it comes to your physicians and your doctors and things like that. Because again, going back to the point of me being asymptomatic, I do sometimes, it kind of stops me in my tracks a little bit when I think about what could have happened if I hadn't been under the care of a physician, if being asymptomatic. And that just is so startling to me. And I really don't ever want somebody to be in that same position where they're caught off guard by something as scary or as potentially fatal as an aneurysm or failing aortic valve for that matter. So I think it's an awesome opportunity to get that awareness out. And with the Women of Impact, it is a little bit more designed to focusing on cardiac disease in women. And just some startling facts is that to date, cardiac disease is the #1 killer of women, and that's scary. That is something that, we don't often think about. We don't often talk about. I don't know that, American Heart Month is as talked about as some of the other months that are dedicated to illnesses or disease. And, being the #1, killer of women, 1 in 3 women die from a cardiac event. And I think that is astonishing, truthfully. And honestly, before I started this campaign, wouldn't have known that fact. But now that I do know it, it's something that I want to share with as many people as possible, because it is something that we should be talking about. It is something that we should be talking to our sisters and our mothers and our aunts and our nieces and our cousins about getting themselves checked out, having a baseline, knowing their risk factors, and living a more healthy lifestyle, where needed. The fact of the matter is that I think it's like 45% of 20 years old, or 20 years or older, 45% of women already have a cardiac disease. And I don't know what statistic of them know it or don't know it, but that's almost half the population of women older than 20 are experiencing cardiac disease. And so, awareness is key. It's, to me, the first step of lowering that number, because the more that you are aware, the more action that you're taking to prevent and potentially treat and correct any issues that are taking place in your body.
Absolutely. Yeah, I think that's a great catchphrase, if you will, like lower that number, right? Raise awareness so we can lower that number, because that is startling. And I think looking at your journey, what you're doing now with the campaign, you were so young, right? You don't even, you wouldn't think that. You wouldn't think that at that age you would have open heart surgery, right? And so you are, in essence, that walking misconception almost, right? That
Absolutely.
you wouldn't expect that you would be the person to have it because of how we stereotype it. And to think that 1 in 3 women die from this is it is a startling number. It's a scary number. And so I really, looking to you, I can appreciate, I've learned so much just talking to you, right? And I can appreciate how much knowledge you bring to the table, even if it's through experiences that we all hope to avoid, right? So it's really big. And with that, and your focus on what you're doing right now, I mean, a lot of that is giving back, right? Giving back in the sense of awareness, knowledge, support, and getting that message out there, because it's a tough topic. And I think you're right. I don't think that we talk about this as much as we should, whether it's just American Heart Month as a whole or heart health as a whole. So much is going on in the world that it's easy for things to fade into the background. And this, given our statistics, is certainly one of those things that we want to keep in the foreground so we can keep working towards a healthier community for everyone.
And, I think, we're talking about specifically about the campaign and giving back to the community. One of the things I did want to, talk about is a little bit about MedPro and how they have really aligned with me and partnered with me during this campaign to not just raise funds. And yes, they have decided to sponsor my campaign, which is amazing. But more importantly, a part of that sponsorship is actually getting back to the community and providing a CPR training kit for people to learn and train on CPR. And that will be able to, each kit that we're sponsoring can train 10 people at a time. But the best thing about it is it's reusable.
Yeah.
So yes, we train 10 people today, we train 10 people tomorrow, we train 10 people every day for a year, whatever it takes, because a majority of the time when you're having a cardiac event, while CPR won't ultimately bring you back or save you in that sense, it can help to maintain your levels until medical personnel arrive. And so many people don't know CPR. We think we know it because we see things on TV, medical shows and things like that. But we don't really know how to do it effectively so that it can be that life-saving tool for when the medical professionals arrive. Because not everybody's in the, has the luck to have a cardiac event near or in a hospital. We're usually or around work, colleagues, friends, family members. So the more that we can educate people on CPR and these life-saving first aid, even, the more likelihood of a survival rate for somebody going through a cardiac event. So I think it's super important that, there's dollars again associated with this, which is awesome, but even more so the impact that this can have on the community and training more and more people to effectively and confidently be able to use CPR in an emergency situation.
Yeah, I couldn't agree more. I mean, I think we often think of that as being a medical professional's responsibility, right? But anyone can go and get CPR and first aid certified. I, way back when, I know I got my CPR and first aid certification, and I should have inspired me to redo it. Because you don't know. And I really want to hone on the confidence part, because it's one thing to have this skill, right? But the reality is when we're learning it, we're not practicing on a real person, right? And so being in that moment and trusting yourself that you can do it, it is a lot, right? So if you are thinking about going out and getting that certification, don't hesitate to ask questions, right? So that when, hopefully it doesn't, but when and if that time comes that you feel like, oh man, I can jump in, I can do, you feel that you can jump in and you can do this. But I love that. And I love that they're reusable. Did not know that.
That was the best thing. Yeah. I thought that was such a no-brainer as far as like continuously being able to train new people, students even, especially with all of the after school activities and things like that. You hear these stories about, young athletes collapsing on a football field or a soccer field or a baseball diamond, and there's nobody there to assist. So if we had, trainers and coaches or other athletes who were confident and trained in CPR, that would be such a skill. First of all, it's such a useful skill, but also so almost critical and invaluable in a life-saving situation like that.
Yeah. I mean, it's support in a whole other way, right? And if we had more people that had the ability to do it, it would also become less of a stressor, because it'd almost be like a norm, right? If you think about your friend group, if every single one of you was capable of giving CPR and first aid, you'd probably feel more confident because you're surrounded by a group of people who can do it, right? And so getting that out and spreading that in the community, and I'm very grateful that our company, that MetPro, is sponsoring that and getting a piece of it back to the community, because if we think about our population in South Florida, we're a very, very diverse population, and whether it's retirees or college students, we have a ton of athletes, or military, or you name it. I mean, we have it. Right. So if every person in our little community has had access to this, had the knowledge, the awareness, and the skill and confidence to be a part of the solution to lower that number, I mean, what an impact would that have on our overall health?
Absolutely.
Yeah.
And I think it's actually, one of the things in researching American Heart Association after being nominated and everything, and talking specifically about how this affects women, I think it's actually surprising to also know that women are less likely to receive CPR. Because there is kind of a little bit of a stigma as to where our hearts are placed in our body, that there's an uncomfortability with that. Yeah. And so I think, again, the more you can train people to feel confident and feel comfortable with giving CPR, hopefully that number changes.
Yeah.
And women are no longer the least likely to receive CPR. And again, why it's so important for us to be advocates of our own health, because there's right now, the way it stands today, statistically speaking, if we experienced a cardiac event, we might not receive the needed CPR that would, kind of save our lives in that situation. So even more reason for us to be aware and prevent as much as possible and be our own advocate.
Wow. Yeah, I mean, not something that even comes to my mind. As a woman, it's not the first thing that comes to my head.
I was surprised when I found out as well.
But I can see it. I can see why, and just thinking about that ultimate impact, right? That someone might not be receiving what they need in that moment because that level of discomfort is there. Wow. Like flabbergasted. Thank you for sharing that statistic along with all the others. Yeah.
It's very eye-opening.
I believe it. Yeah. No, it's not something I would think about unless someone else brought it up to me and they're like, oh yeah, that makes sense. That I can see how that might happen. Wow. So, to kind of wrap things up, I did a little bit of research on my own as well into the American Heart Association, because American Heart Month is really what they're driving. And so a little fun fact for our listeners, they've actually been around for 100 years. This is their 100-year anniversary this year, which is crazy to me. And when I was reading the bio, it was started by six cardiologists. 6 people got together and said, we need to spread some awareness around this. We need to have a conversation around it. And if we think about our conversation, right? 2 more people talking about it. If you add our organization and then build up to the greater community, we can go from 6 people 100 years ago having this conversation to 100,000 million people having the conversation, ultimately changing where we are today and continuing this momentum of creating a more heart healthy life and community. And
Absolutely.
That's really impactful to think about. It only took 6 people to start it. So think about how much we can do, whether it's donating kits or getting CPR certified or sharing this podcast, right? Or sharing the message, going to the doctor, having a conversation. I mean, this is an opportunity to really grow the impact and I'm going to keep going back to what you said because I love it and it's catchy, to lower that number. I love it.
Yes. Less
So that we
people
can-
being affected because
Yes.
they are more preventative. Absolutely.
Yes.
I agree.
So anything, Christi, that you want to add, or last thought that you want to share, a piece of advice for our listeners that you want to put out?
I mean, I think, it's clear why they picked February for Heart Month. Obviously, Valentine's Day, it's all, red centric and
Yes.
and heart related, which is great. So just every year when this month comes around, even if you're not really paying attention the 11 other months, be present in this month and use this opportunity to think about your lifestyle, see if there's changes that you could make to your overall, heart health. See a cardiologist, or press your primary physician to do some additional testing, so that you can have that baseline. And again, even if it's only happening once a year, it's probably one more year than you were doing before. And keeping in mind that so much of cardiac disease is preventable and treatable. So, if you can live that heart healthy lifestyle and prevent it, that's great. But that early diagnosis with anything that comes your way, just take on that treatment plan, use the resources available to you, seek help, and hopefully, like I said, be able to correct the issue and be able to live a healthy lifestyle for a long time after that. Yeah. So just be aware. Spread awareness, talk about it, talk to your friends about it, make it more of a conversation instead of something that we shy away from, because people tend not want to talk about health. And I just think, we got to culturally change that here, especially in the United States. So the more things that we can do like this podcast, the more things that we can do by the Go Red campaign or any of the other American Heart Association campaigns that they have all year long, it's our opportunity to just spread that awareness and make people known.
Yeah, absolutely. And actually, as you were speaking, it reminded me of one additional thing. When it comes to having the conversation, sharing, there are a lot of, when we spoke, there are a lot of support groups out there.
Absolutely.
And a lot of them you can find through an organization like American Heart Association. I promise there are many, many others. But finding those connection points is also a great starting point in building that community and finding the support, because maybe you are someone who themselves is dealing with a heart disease. Maybe you know someone, maybe a loved one is going through it. So finding those support groups might be a really good place to start to help you navigate that journey, no matter what that journey is, right? No matter which part of it you're playing, there's a support group out there, and the numbers are staggering right now. So you may know someone who's going through it. So having that conversation and keeping it going and taking the time to, like you said, make that February that red everywhere.
Exactly. Yeah. And I think it is important, to your point, you're not alone. And there are, thousands of people, not hundreds of thousands, again, not a medical professional, don't know, that are going through the same thing that you are going through. And so using those support groups to, isolation is the worst thing for anybody dealing with any issue. And specifically with heart disease, you're definitely not alone. And there are tons of support groups, especially through American Heart Association, for whatever your situation might be, so that you can find information, but also you can find overall support in what you're dealing with.
Yeah, absolutely. Yeah. So Christi, thank you again for taking the time to educate us, share your story with us, talk a little bit about the campaign that you're working on right now. Congratulations on your nomination, your award. We're really excited for you, and happy American Heart Month.
Thank you. You too.
Thank you.